The patellar jerk, better known as the knee jerk, is a deep tendon reflex that occurs when the knee is tapped in the area below the kneecap, formerly called the patella. The automatic response to this action is seen as sudden kicking movement of the lower leg.
Tap on the patellar ligament excites the nerve endings of the muscle spindle and the quadriceps femoris. Stretch signals travel to the spinal cord via afferent nerve fiber and posterior root. Afferent neuron excites the motor neuron in the spinal cord. Afferent signals in the motor nerve fiber stimulate quadriceps to contact, producing the knee jerk. At the same time, a branch of afferent nerve fiber stimulates the inhibitory motor neuron in the spinal cord. That neuron inhibits the motor neuron that supplies the hamstring muscles. Hamstring contraction is inhibited, so hamstrings, knee flexors, do not go and antagonize the quadriceps, knee extender.
A hit to the knee causes the thigh muscle to stretch. This stretch sends a signal along a sensory neuron to the spinal cord where it interacts directly with a motor neuron that travels to the thigh muscle. The muscle then contracts and causes the leg to kick. This is known as a monosynaptic response, being that the impulse only has to jump from one nerve to another once. Not only that, but this reflex is often known as a no-brainer because the brain is not in any way involved with it. This is a knee test that is often performed by doctors, usually during physicals or just normal checkups. Although often overlooked and seen as a simple test where a doctor is lightly hitting your knee with some medical stick, if there is no response to the knee tap performed, it can indicate nerve damage or illnesses such as cerebellar disease. Some of these cerebellar diseases include ataxia and dysmetria, which are disorders that result from problems with the cerebellum, the area of the brain that controls coordination and balance. When we stand upright, our muscles constantly stretch and contract slightly just to keep us balanced. The patellar jerk reflex is part of this system. For example, if you're standing and start to lean back too much, leaning back stretches your quadriceps and triggers the reflex. However, the muscle contraction won't kick your leg upward this time because you're standing on it. Instead, the contraction simply brings you back to the center, preventing you from falling backward.